Hi, my name is Gabby and I'm just completing the 4-week Integrative Medicine course at the University of Miami Miller School of Medicine. I took this as one of my electives during 4th year, and I knew this was a factor of medicine that I really wanted to prioritize. So me and my friends we were planning all year, all of phase 3, to make sure we could get this really unique and valuable experience. There are a lot of keys to integrative medicine that I feel like were really well presented here, not just in the topic of integrative medicine, but just about how a really well-developed curriculum could be done in a medical school. So with integrative medicine, we had a really awesome mix of lectures, classes, like student-to-student presentations, and practical experiences. So not only were we hearing from different experts in the fields about different components of integrative medicine, like acupuncture, herbal medicines, traditional Chinese medicines, hypnotism, and all these other really unique and very important, valuable, and legitimate forms of creating wellness in our patients. But we also got to go to different clinics, PT, OT, chiropractors, the whole health counselors at the VA. We got to do things practically for ourselves, yoga classes, yoga nidra, having cooking classes, having a potluck. It was an amazing experience in not only learning the core values of integrative medicine, but also learning how we can incorporate it into our own lives. And then throughout our careers, not just here's the information that you're going to use and carry with you, but how do we critically evaluate studies as they're coming out? How do we critically evaluate the options that we have for our patients? And then how can we apply this to our own lives? How can we make sure that we're not pouring from an empty cup? How can we make sure that we are taking care of ourselves as physicians and have a really fulfilling lifelong learning and fulfilling and I guess respectful physician-patient relationships. I'm really happy that we had the opportunity to do this elective, and I would absolutely recommend it to anyone. If you're skeptical about these types of medicines, if you feel like it's not legitimate, that's an even better reason to do it. I think that this is something that our patients already know about and is becoming more and more apparent on social media, and I think it's a reaction to desire for patients to be more well than our health system is currently able to make them. So we as physicians have to be able to interact with this information. We have to be able to respond appropriately because our patients, so many of them, are already doing this. And if physicians aren't knowledgeable and aren't able to provide them with the expertise and the advice, then they're going to be going to less reliable sources, maybe even predatory sources that can make a buck off them, who maybe don't have their best interests at heart. And then also, just from a cultural competency perspective, a lot of these medicines are things that people have been doing for generations in their families, and it's important that we preserve the physician-patient relationship by being really, really open and acknowledging the value of these traditional medicines.
Hi, I'm Lindsay. I just finished the 4-week Integrative Health elective, and I really enjoyed it. I wish that all of med school was taught this way, to be honest. It's a small group discussion-based class with a ton of very interactive learning experiences that I think is really good for just building discussion and engaging with the material. Some of my favorite parts about this elective were getting to really use my imagination and creativity in a way that we don't always get the chance to do in med school. Also, I think one of my biggest takeaways from taking this course is just really remembering to question what we're learning and ask why, which I think is a super valuable skill. And apart from that, it's, as someone who wants to do primary care, it's so great to have the opportunity to learn more kind of in-depth discussions about nutrition, lifestyle, movement, and so many different topics. So thank you.
Hi, my name's Haley. I'm a 4th year student here at Miller, and I just finished up my integrative medicine elective at the Osher Center. It has been an excellent 4 weeks. I've learned so many things that will be helpful in my future practice and helping my patients, and also has been really helpful just in my own sort of wellness journey. I think that some of the most interesting things that we talked about in class was the microbiome and how to really cultivate our gut health and how important that is to our overall health. That's something that I really didn't get much information about anywhere else in my medical school curriculum so far. and also getting to not only see and learn about, but experience a lot of the things such as acupuncture and yoga, and different techniques that we might be recommending for our patients. I'm going into OBGYN, and I think that there's huge opportunities for patients to experience a lot of different integrative medicine modalities, and I definitely feel more confident in being able to discuss these with my patients and recommend them different types of therapies. So I've really enjoyed this elective, and it's going to make me a better physician.
Hello, my name is Julia. I'm a fourth year MD/MPH student here at Miller. I just finished the 4-week elective for integrative medicine, and I thought it was really useful in the way of teaching me a lot of the soft skills that you don't often get in med school with regards to how to speak with a patient and how to counsel them on different aspects of their management, and really working with them as a team, as taking the patient as a huge participant in their healthcare, and really learning how to empower them to take that role and encouraging them to do so. Along with that, we really emphasize a lot of critical appraisal of literature skills and how we can use that to broaden our scope and not just stick with the same things that we've always been taught, but learn how to apply what we're learning to different aspects of medicine and really be updated with the things that our patients are doing and how they're bringing that information to us. I feel like I always kind of wanted to step on the outside of the establishment and learn a little bit more about the way that other people are doing things and not get so caught up in the rigid structure of how medical school often makes us be. And this was a really great way to kind of take that step back and look at what we're doing and how we can really help the patient, and not being afraid to do something different that may be beneficial for them. So overall, I highly recommend this elective, and I think that it taught us a lot of things that really will be useful in residency, and then especially when I'm working out on my own. And I think it's a great also breath of fresh air to take at the end of med school.
Hi, my name is Kurt. I'm a fourth year medical student here at the Miller School of Medicine. I've just completed our integrative medicine ACE, and it's been a really great experience. I've really enjoyed sort of taking a deeper look into some of these areas of healthcare and medicine that we don't really get a chance to see during the rest of our curriculum, and sort of take a moment to look at them with an inquisitive eye, sort of evaluate the literature, see what the validity is, what the data is, and sort of see where we might be able to apply this into our practices. It's also been a great opportunity to sort of explore how I want to fit sort of these concepts of mindfulness, meditation, yoga, diet, nutrition into how I'm going to, recommend to my future patients, and how I would like to incorporate these into my own lifestyle and sort of make positive changes for myself. So overall, it's been a really great opportunity to be able to spend all this time and sort of just learn. It's been great.
Hi, my name is Melissa Huberman. I'm a fourth year medical student at the University of Miami, and I'm just completing the Integrative Medicine elective here at the Osher Center. It has been a fantastic experience getting to explore what integrative medicine is, getting to understand better about the planetary sciences, as well as how diet and nutrition can deeply affect health and how to use it in clinical practice. I think that it has been a very immersive class. We really have dived deep into some of the integrative health strategies, into looking into what we ask our patients to do when we say eat a healthy diet, when we say, use lifestyle modifications, try to, de-stress, what that means and what it can look like. I think that it's been really insightful to see how it can be applied. I'm someone who's going into a subspecialty of pediatric neurology, and so I think that it really gave me a lot of opportunity to explore what I could do not only in my practice, but what is happening outside of my practice. And I think that it was a really great opportunity for me to see upcoming literature and areas of just areas that I could study and learn more about. Especially here in Miami, where our patients come to us with rich cultural histories and backgrounds, it's so important for us to be able to respect those traditions and the cultures and have just a better understanding of what they're bringing in as they bring their questions, both from their past or the present. Especially with all of the news and information on social media, I really love to be able to inform myself better on all of the new health trends that are going on and the very ancient ones.
Hi, I'm Liz. I'm an MS3 who's currently finishing up the Integrative Medicine course, and I'm here to just talk a little bit about the things that I've learned over the past few weeks and kind of my takeaways. So throughout these past 4 weeks, we've spent a lot of time discussing planetary health, nutrition, mind-body medicine, and renewal strategies and how we can incorporate that into patient care. I will say before coming here, I had been on clinicals and I had just stepped away from my studying for my boards, and so I was very stuck in this like traditional medicine space where I wasn't really thinking about different other things that could affect the patient. And so this integrative medicine elective is going to be great as I go on to my next electives, as I now have a better idea as to what strategies I could incorporate and advise my patients on. So for example, different types of diets for different types of diseases and how that can affect their overall well-being, not only physically, but also emotionally and physiologically. I can also recommend like different meditation strategies, strategies for pain, such as acupuncture, yoga, different forms of exercises, energy medicine for patients who believe that is something that could help them in their care and their healing journey. So we had an experience with a Qigong class, which I would say is the more strange thing that I have experienced, because I've seen it in the movies and it's not really Qigong, it's more Tai Chi. But going through that experience and kind of seeing what the practice is based on and how that can make you feel made me see how that could help our patients in the future and in the healing journey. I would say nutrition was one of the biggest weeks for me, and also this week about renewal and just kind of restoration and about how the different spaces we inhabit can impact our health was also one of the biggest weeks, because we don't really think about how the world around us affects us until we stop to think about how we don't really have the best transportation system that's geared towards doing exercise and things like that. So it'll be cool to see how, as we progress in our journey in medicine, we can impact city planning and the way that our patients interact with their environments, such as going to parks and different things like that. So seeing all those things will be really fun.